Hello, and welcome to the CDO Magazine interview series. I'm Tim Brooks with Worldwide Technology, and we're partnering with CDO Magazine, MIT CDO IQ, and the International Society of Chief Data Officers in a series of interviews with global leaders in data strategy. Today, I have the pleasure of speaking with Mayank Anand, VP of Data Strategy and Management for GlaxoSmithKline. Hello, Mayank.
Hi.
Good to meet you. Hey, Mayank, as we get started, just for our viewers, tell everybody, many people know GlaxoSmithKline, but I don't want to assume that everyone does. Tell us about the organization and your responsibilities in the company.
Yeah, so GSK is a very well-known name in the pharmaceutical as well as consumer health. We as an organization have a very, very long history in providing solutioning, whether it is consumer health or pharmaceutical. If you see our organization at this point of time, we are going through a big change and we are going through a big transformation where consumer health will become a separate arm and pharma will be a separate arm. When I say pharmaceutical arm, it includes vaccines, oncology, specialty. So we have a very therapeutic area experience and we are exploring some of the molecules, vaccines, and drugs to help our patients across the world. At this point of time, we are going through a big transformational journey, and I am sure this is for the benefit of the organization in the long run.
Wonderful. So you're the vice president of data strategy in this large global company. Tell us, what does that mean? What is it? What are your general responsibilities as part of that transformation?
So I'm new to this role. I joined in January 2021, so I will say 2.5 months. But the expectation from this role is to make sure that there is a global strategy in terms of data flow across the clinical studies. As you know, GSK run hundreds of studies every year in clinical space. We have different therapeutic areas, different complexity around it. So the key focus and motive is to make sure there is one global strategy to manage across the therapeutic area, make them work in the similar ways of working, and putting the right set of innovation and technology to support this data flow.
Got it. So very strategic and very important position. I guess my question is, I grew up and didn't know that I would get and become a data strategist or even consult the organizations on things like artificial intelligence and machine learning. When did you decide that you fell in love with data strategy and data in general, and how did that happen?
So you're correct, and I come from India. That also a very small town in North India where even the term like clinical was not in so much use. People were not even aware. My journey started as a faculty for human genetics after completing my master's in biotechnology. I started teaching, and then one day someone came and said, there is a job for clinical data management. And I was like, what it is? In those days in India, it was called as call center jobs because you don't know what it is and you cannot explain people. And there's a very funny side of it that it took me almost 7 to 8 years to explain my parents that I don't work in a call center. I actually work on a data side because as grown-up kids, they were only known that there are medical jobs or research job. Rest everything is more like a call center or a BPO. But I think so as I was growing into this role, my first job with Accenture, then to Cognizant and TCS, by the time I completed my 4th or 5th year in the organization, different roles, I realized that there is a bigger future for this. I remember days when data strategies were always kept as secondary and technology enhancement and transformations were the primary thing. But I think so those transformation and technology enhancement brought us on the front seat. And I have seen changes since 2015 onwards when CDOs, the Chief Data Officer roles, became more prominent. So for me, my ambition to become a data strategist went back, I think it was in 2012 or 13 when I thought first time that there is something like this I can achieve in life, and then started working towards it. Spend a lot of time in understanding the domains because we have multiple sub-functions, understanding their needs, understanding the global perspective, and not limit myself only to India and just the back office outsourcing. And then definitely after looking into some of the CDOs across the world, whether it was in Novartis, in BMS, in Pfizer, in Merck, in all the organization, I realized one thing that data is the future. And in post 2015, conferences started talking about data. There were discussions where people were talking about data as a boon or curse. There were discussions around real world evidence. There were discussion about AI, ML. And then I said, this is the place I want to be. And I think so I'm on the right path. So if you ask me in reality, 2012 or 13, when I really started thinking about it, and I think so 2021 made it true, coming into this role and playing this role and also helping organization and my team to grow in this area for future.